Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in this very interesting case of a patient who attended with a blocked left ear. And it's probably a first for me, but this patient couldn't stop giggling during the procedure. And that was offset by me performing the procedure. The patient didn't just come in giggling away. And so they were very ticklish during the procedure, and that could be due to a couple of reasons. It may be because of all these hairs, as you can see. So this patient's ear canal is quite hairy, but it could also be due to stimulation of the Arnold's nerve, which is the branch of the vagus nerve. So running at the back of the ear canal, I would say between 3 and 6 o'clock is the Arnold's nerve, which, as mentioned, is a branch of the vagus nerve. If you stimulate the Arnold's nerve, you can then stimulate the vagus nerve, and that can cause one of several things. It can cause the patient to cough. So they can get a cough reflex. They can have a gagging fit. They can also have teary eyes because it can stimulate the lacrimal gland. Patients can also experience auditory syncope, or also known as the vasovagal response. So the vagus nerve has several functions. It stimulates the parasympathetic system, and that can lead to a reduced heart rate, dilation of your arteries, which ultimately means there's less blood flow going to your brain, which can leave you very dizzy, and some people can actually faint. The vagus nerve also helps with digestion, for example, and so I was just kind of reading up and said, well, can the vagus response also stimulate a patient finding it very ticklish and experiencing constant giggling? And apparently so. So it's very interesting. And of course, the difficulty for me was when a patient is giggling a lot, that I'm in their ear with some sharp instruments. So, there's not much they could really do about it. But this is where the WAXscope was quite helpful, actually, because the speculum helped to stabilize the instrument in the ear. So you can see they've got a tremendous amount of earwax. This wax was extending from the entrance all the way to the eardrum, and this part here, it's lodged just past the second bend. You can see the cartilage in front of it's almost engulfing it, so I've had to drag this down underneath the cartilage in order to remove it. It's quite matted, which can also make it a bit more difficult to remove, so I did put some olive oil spray to help just soften, lubricate this wax and to help me get a better suction grip. There is the peripheral of this wax plug, it was enveloped in a lot of dead skin, which I just removed there. Very dark wax. It's been there for a while, and the patient was quite surprised by how much wax we removed. If you watch till the end of the video, I've got a still image. So this wax is possibly now latter half, I would say, probably a bit deeper, probably the inner third. And I'm just giving it a little wriggle. To the left, you can see that flesh, that's the second bend. So up to the second bend, this patient's ear was quite narrow. But you will see at the end of the procedure, once I remove the wax, if you're able to stretch open the second bend, which is what we do with the speculum, the inner half of the ear canal, so the medial aspect, the ear canal was a lot more, significantly wider actually, which can make this difficult to remove because the plug deeper in the ear is larger than that region of the second bend in the ear canal. So we're having to kind of, as you can see, manipulate and tease this through. So I'm just wriggling it up and down, left to right, around in circles. And I'm slowly just teasing this. And this bit comes out in, I think that's a sizable chunk. And once I remove this piece, I thought, well, job done. That surely there can't be any more wax. But lo and behold, there was quite a lot more even after this. Because of the hairs, as I said, it can be difficult to get suction grip. And I'm just trying to navigate this around the bend. So not only is it narrow in this portion, it's also quite bendy. You can see all those hairs that are matted. These hairs are also attached and stuck to the ear canal. So it's almost playing tug of war. So I've just stretched open the ear a bit more around that second bend region. And it is coming away, it's breaking off in little pieces. I'm just going to go a bit higher up in the ear canal. Again, I'm just going to tease this through, trying to bring it inside the second bend there. Once I brought it inside, I can come back around the ear. So I thought that was all the wax, but we got this other piece which is deeper. This is when I really start to stretch the ear open. And you can just tell by the colour it's been there for a while. And some of these hairs, they're a bit deeper than usual. Normally, especially the hairs to the left, when you insert the specular, it pushes those hairs out of the way, but these are just a bit deeper, so the speculum doesn't really reach those. Not at this stage anyway, because I'm obviously don't want to go too in because I need to visualize the wax. Now I'm going to stretch open the ear. There we are. So you can see we push some of those hairs out of the way. It's going to get the eardrum in focus. That wax was stuck to the drum. You can see where it was adhered on the hammer bone. And you can see the umbo, the centre part of the eardrum, that's normally depressed. It's buckled inwards, and that's how it should be. So you can actually see that orientation. So you can see some wax there stuck to the anterior portion of the eardrum. So that's all the wax I removed from one ear. So it's quite a haul. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.